Hello, it's Dr. Mary Manis, and we're talking about professionalism in osteopathic medicine, ethics in action. Presentation objectives are to identify expectations for ethics and professionalism by Sam Houston State University College of Osteopathic Medicine student doctors, and to identify assessment opportunities for ethics in shsu.com professionalism curriculum. So what are the expectations for ethics and professionalism? Please recall, we've reviewed the requirements for a profession. We've reviewed the 6 ethical foundations in professionalism, and we've briefly discussed ways in which these can be applied in medical practice and the associated concepts. So we're going to expand on these things today. Also, if you'd recall, the AOA has expectations for professionalism, primacy of patient need, respect for people and cultures, awareness and action regarding health disparities, regulation of peers and self, lawfulness, and legitimacy. The COM as well has expectations for professionalism. These are outlined in programmatic level learning objectives: respect, compassion, probity, honesty, and trustworthiness, ethical principles in all activities, including informed consent and confidentiality in patient care, awareness and attention to issues of culture, religion, age, gender, sexual orientation, and mental and physical disabilities, self-care and principles of wellness, lifelong learning skills, accountability to patients, society, and profession, and learning communities for relationships promoting compassion and understanding. When we combine these, when we combine the foundations, the professional expectations, and the educational expectations, they look like this. Expectations for ethics and professionalism: autonomy, informed consent, primacy of patient need. Non-maleficence, patient safety, physician boundaries, physician wellness, lawfulness, self-care, lifelong learning skills. Fidelity, communication, probity, honesty, trustworthiness, confidentiality, and regulation of peers and self. Justice, social determinants of health, awareness and action regarding health disparities. Beneficence, empathy, cultural aspects of health, awareness of issues of culture, religion, age, gender, sexual orientation, and mental and physical disabilities, health promotion, respect, compassion, and finally, utility, health systems, evidence-based medicine, quality, and accountability. So how can ethics in professionalism be assessed? One example of a professionalism assessment for the expectation of informed consent, that physicians obtain informed consent for medical interventions, is that when analyzing case scenarios, the student doctor notes that benefits, risks, and alternatives, including support for self-healing or osteopathic manipulative therapy, should be included when discussing treatment options with the patient. Student demonstrates professionalism's foundational ethical principle of autonomy in this example. If the expectation is that physicians act to protect patient safety, an example of an assessment for student doctors would be demonstrating competence in hand washing and donning and doffing personal protective equipment. Thereby, the student demonstrates professionalism's foundational ethical principle of non-maleficence, patient safety. Another assessment involves the expectation that physicians practiced honest communication. So an example would be when introducing themselves to patients in clerkship preceptors' offices, the student doctor accurately states their role in the patient's care. The student would be demonstrating professionals' foundational ethical principle of fidelity. An assessment for the expectation that physicians recognize and work to eliminate unfair distribution of health resources would be when interviewing standardized patients, the student doctor includes questions regarding social determinants of health when gathering the complete medical history. This student would be demonstrating professionalism's foundational ethical principle of justice. When the expectation for physicians is to demonstrate empathy, this can be demonstrated when the student doctor responds with attempts to understand the patient's perspective and to help when a high fidelity mannequin expresses discomfort during clinical simulations. Yes, that will happen. The student demonstrates professionalism's foundational ethical principle of beneficence. And finally, if the expectation is that physicians work within health systems to improve quality, maximize benefits, and minimize costs, the student doctor utilizes evidence-based medicine principles of pre and post probabilities when proposing diagnostic testing during analysis of clinical scenarios, and thereby demonstrates professionalism's foundational ethical principle of utility. As you can see, and as we've already discussed, professionalism and now ethical principles and their commitment can actually be assessed in every course, in every activity, in every setting, and with every patient, whether actual, virtual, simulated, standardized, etc. We will return to ethical principles later in the semester and, of course, longitudinally throughout clinical medicine. Thank you.